And the ground keeps shifting the more we learn about how the disease, the COVID ground that is, keeps shifting, the more we learn about how the disease and our immunity are evolving. The Prime Minister's now said that he's looking at the possibility of reducing quarantine to 5 days. The disease does appear to be morphing into a pandemic of the unvaccinated. There was what appeared to be an unofficial Twitter campaign of senior medics last night under the hashtag #GetVaccinated, all saying they'd been vaccinated and their COVID wards were full of unvaccinated patients. It followed an interview on our sister programme, Broadcasting House, with Dr. Steve James, a consultant anaesthetist who had challenged the Health Secretary last week, saying the science doesn't support mandatory vaccination of healthcare staff. Here's part of what he said yesterday.
I thought to myself, there's a good chance I've probably been exposed to the virus, having worked with it on a regular basis since the start of the pandemic. I'm in a good, healthy shape. I thought, well, let's see to ride this out. And maybe there are some issues with vaccination that will arise, and I didn't feel there was a rush to go and take it. So personal preference, didn't feel the need. I haven't seen a patient of my age and my level of health present to intensive care. So you've got to see that in the group that presents, it's effective. The second issue is transmission and the sort of pro-social argument. The vaccine will decrease transmission for people who've had the vaccine for about 8 weeks relative to people who haven't had the vaccine. That means if I want to have a clinically significantly better or decreased transmission compared with someone who isn't vaccinated, I'm going to need to be vaccinated more often than every 8 weeks.
Well, Dr. Alison Pittard is Dean of the Faculty of Intensive Care Medicine and a consultant in anaesthesia. I asked how widespread that feeling was among her colleagues.
The majority of colleagues who I speak to have been vaccinated. And the reason we're all being vaccinated is because we trust the science, we see the data, and we see the impact that is having on patients coming to hospital and their outcomes. And of course, mandatory vaccination for healthcare workers is nothing new. For instance, hepatitis B, we've been vaccinated for hepatitis B for many, many years. And it's really important that we do what we can to not only protect ourselves, but to protect our patients as well.
The reasons that somebody should get vaccinated, if there's somebody who, like Steve James, is young, has probably had the infection, should they think, I don't need to?
What one doesn't know is when you get infected, how severe it's going to be. We don't have a crystal ball that we can look into. And of course, having the vaccination doesn't just protect you, but reduces your risk of transmitting the virus to other people.
So even though we've heard of, for example, in King's College Hospital, the boss of the hospital suggesting that there could be as many as 10%, 1,000 staff who won't be able to work because they haven't been vaccinated, do you support mandatory vaccination among healthcare workers?
I think what's important is our professional responsibility to protect ourselves so that we can continue to work to provide the care that we've been trained for. And I do think that is our responsibility.
So are you suggesting that Dr. Steve James isn't being professionally responsible?
I think it's important to listen to the science and the advice that we're getting from the healthcare scientific advisors. And we know that being vaccinated ourselves not only protects us, allows us to continue to work and provide care for others. I think it's very difficult to understand exactly where Dr. James was coming from. But as I've said, we do have a responsibility. We owe it to our patients to look after ourselves and others.
Well, what about the claims made by Dr. Steve James? We thought we should fact-check them. Dr. Adam Finn is on the JCVI, the Joint Committee for Vaccination and Immunisation. I asked first if Dr. Steve James was right that he was unlikely to get seriously ill from COVID and, having been infected, probably didn't need to get vaccinated.
Assuming he really genuinely has had the infection, he will have a degree of immunity which will mean that he's very unlikely, particularly at his age, to get seriously ill and end up in hospital. It's also the case, though, that we know that people who've both had infection and vaccination have really very strong immunity across a number of different variants.
Now, there was another point he made, which was that we don't know what may yet arise as a result of vaccination, because it is, after all, it is still an experimental vaccine. Is he right that there are still yet could be things that are thrown up from those who have been vaccinated?
Theoretically, yes. In reality, there have been episodes over the last half century of intensive development and use of vaccines where things, unexpected and rare things, have turned up. And they've all tended to do that within a period of just a few weeks, if maybe a small number of months of mass use of the vaccines. So we don't have an example yet of a vaccine where something rare but really rather concerning has shown up, a year or two or three or more later. So it would be unprecedented, but it's theoretically possible.
What about the other point that he makes, which is that vaccination only prevents transmission of the virus, the Omicron variant at least, for about 8 weeks? Is that right?
There are two parts to the ability of the vaccines to interrupt transmission. One is by inducing sterilizing immunity, that is to say, to stop you from getting the infection at all. You clearly can't transmit to other people if you're not infected. And the other part of it is that if you do get the infection despite being vaccinated, the vaccine might make you less infectious to other people. And we do know already that even after the third booster dose, the protection against mild symptomatic infection already wanes by actually more than 10 weeks. It doesn't mean it disappears totally all at once.
Doesn't that call into question some of the policies that have been put in place around the world, like, for example, Australia and other countries, which were devised for perhaps a different variant than Omicron, where it was thought vaccination lasted longer against transmission?
It was already the case that we knew that these vaccines, what they really do well is they protect you against serious disease. Your chances of ending up in hospital or dying of COVID are massively reduced, and actually that capacity endures.
If they are going to infect other people, surely that weakens the argument about whether a nation should be imposing the requirement for double vaccination, whether for entry at borders or for doing anything within a country.
Yes, it does. I mean, the argument about the health service actually is what's been driving lockdowns and is valid. In a sense, we all have a social responsibility to try and avoid ending up in hospital, not just for our own good, but for the good of all. So I think that argument stands. It applies much more strongly, if you like, to adults and particularly elderly adults and people with underlying conditions. But the ability of these vaccines that we have now in any enduring way to produce indirect effects and herd immunity is clearly limited. Omicron has made that even more obvious. And if that is the argument that's being used for compelling people to be immunised, I agree that it's weak.
So if we were to fast forward a few months, given the likely way that vaccination will go, where possibly it'll just be the elderly who are ultimately vaccinated against COVID, whatever variant is, do you see these rules as only being temporary?
Yeah, I think a lot of what's going on at the moment relates to the current situation we're in. These viruses do somehow or other manage to induce us to produce immunity that doesn't last very long. I think there is potential for developing vaccines that do have indirect effects, and I've actually been arguing for years that we should have more focus on this. The model we have for development of drugs and vaccines is very much focused on the individual, and that results in us not really working hard enough towards these indirect effects. It's theoretically possible that we could do that. But with the tools we've got now, we need to focus on their direct effects because that's what they do best.
So will we be requiring everyone to be vaccinated for years to come, or will it just end up being a part of the population?
I think it's quite likely that we will see either these or subsequent versions of coronavirus vaccines in use for some time to come, but in particular focusing on people who are the most likely to get sick and therefore need the protection that they provide.
Dr. Adam Finn of the JCVI. The Home Secretary Priti Patel has published the terms of reference for the first phase of the inquiry